Okay, great. So yeah, I'm going to be talking about run charts today. And I'm going to go over 5 topics. First of all, we're going to talk about how to construct run charts. And I know that I think probably most people on the phone on the call have done this before, so I'm going to go over this fairly quickly. And then I'm going to spend more time talking about how to analyze run charts. And I'm going to go into the math behind the run charts because I think this helps you understand them better. And then I will come on to the more practical stuff, some tips for how to actually use them in improvement projects, and then also how to use and describe them when you're writing articles for publication. And then finally, I'll end with what I see as some sort of common mistakes with using and talking about run charts. And we'll have time for questions and discussion after most of these sections. I'm not able to see the chat when I'm presenting like this, so I'll get into but if you want to put in questions or comments, put them in the chat and we'll get to those at each section. Okay, so let's start with constructing run charts. I think the first thing to do here is to plot the baseline over time. And that's important because what we're trying to do with run charts is look at where the performance is changing. So we want to know what it is at the baseline. And having more data points is better. Starting with 6 is pretty good. Sometimes that's not easy. You need to start your improvement project faster. But you would like sort of at least 3 to get started. And when you do that, you use those data points to put in the median. So you calculate the median and draw in the median. And the next step is what I think people often don't do is you want to extend the median into the future. Because again, this is what you're trying to understand. Is our system performance changing? By comparing it to the baseline median, you can tell whether your system is changing over time. And then as you get new data points, you add those on and look at how they are moving around the median, basically. Okay, so 4 steps with constructing the run chart. First of all, plot the baseline data. Second, calculate and draw the median. Third, extend that baseline median into the future. And 4, plot the new data points. Okay. And then this will help us to analyze the data. Okay, so now let's talk about how to analyze it. Again, I'm going to spend a bit of time going over the math, and then we're going to compare some of the different rules for run charts to see sort of what makes sense to use. All right. So as far as understanding the math, the idea here is that if nothing is happening to the underlying system, right? If you're not doing anything to your unit or your ward, then the median performance will stay the same. And this means that every new data point has a 50% chance of being above the median and a 50% chance of being below the median, okay? And so you can think of the data on a run chart as though it's a coin. If you flip a coin, there's a 50% chance it'll be a head, 50% chance it'll be a tail, okay? And if you start flipping a coin and you get lots of heads in a row, you start to doubt whether that coin is honest anymore. And the same thing with run charts. If you start getting a bunch of points all on one side of the median, you start to be suspicious that your system has changed. It's no longer how it was at the baseline. So we have some poll questions through here. So this is the first question on the poll. If you have a sequence of consecutive data points, all on the same side of the median, what is that called? And Dr. Sonam can put the question up and we'll give everybody about 30 seconds to answer it. So just multiple choice, if you can put in your answer for what this is called. Someone is excited about this question. That's good to hear. And Sonam, I think whenever you see that there's enough answers, you can show us the response.
Okay, sure, sir. So I think Sonam, you can
Yes.
the results.
Yes, we can now end the poll. We have got 69%. So,
Okay.
yeah.
Great. Right. Okay. So a sequence of consecutive points on the same side of the median is called a run. A run. Okay. So we have a run of points on the median. All right. And let's just look at this then. Sorry, how do I move forward now? Okay. Okay. So let's come back to this data. All right. We're going to see what's happening. So the probability of the next point being above the median or below the median is 50-50. Okay, so if we have one data point on the above the median, there was a 50% chance of that happening. The probability of getting two data points on the same side of the median, so a run of 2 points, is 25%. Okay, 50% times 50%. 25%. The probability of getting a run of 3 data points is multiplied by 50% again is 12.5%. The probability of 4 data points all on the same side, so a run of 4 points is 6.25, and it keeps going. You just divide by 2. So 5 points in a row is 3.125, 6 points in a row is 1.5, 7 points is 0.78. Okay, and so we're looking for long runs. If we start to see long runs, that is telling us that the system has changed. Okay, and next poll question. So how many data points in a run are enough to suggest that the system has changed? 4, 5, 6, 7, or 8. And again, Sonam, as soon as you see we have kind of enough responses, please just show us the results.
Sure, sir.
Thank you.
Sonam, you can show, I think, 100% answer.
Oh, okay, sir. Sure. So here are the results.
Great. Okay. And so the most common answer here is 6, but we've got answers all over the place. So I'm not surprised that most people are saying 6 because that's generally what the teaching is. But the actual answer is it depends. Okay, and let's go over why that is. All right. Okay. So 6 points in a row is actually not quite right. All right. And, you know, if you look at data, the probability of getting, if you flip a coin 6 times, the probability of getting 6 heads in a row is very low. It's 1.56. But even if we have a data like this, where we have 16 data points, each of those six points has a probability of getting 6 in a row of heads. So there's a 1.56% chance of getting 6 points above the median for the first 6 points. And there's a 1.6% chance of getting it for the 7 data points. So if you flip a coin 6 times, there is that 1.56% chance of getting 6 heads. But if you flip the coin 7 times, there is a higher probability of getting 6 heads in a row. And this makes sense. If we flip a coin hundreds of times, you're definitely going to get 6 heads in a row at some point, right? And so if we flipped a coin 52 times, let's say you collected data for 1 year, weekly data for 1 year, there would be a 33% chance of getting data points all above the median, and a 33% chance of getting 6 data points in a row, all below the median. Okay, and if you collected data for a year, daily data for a year, you would almost certainly get a run of 6 points above the median and below the median. Okay, and there's a calculator here if you want to sort of go and look at this for yourself. If you want to go and look at what the probability of getting, 6 points above the median for whatever length of data you have. All right, and so this is why 6 data points is not really enough. It makes sense if you only have a very small amount of data, but it really doesn't make sense if you have a larger amount of data, once you're starting to get 15, 20 more data points in a row. Okay, and there is an article that came out a couple of years that looked at the different types of rules and compared them using simulated data. And we'll look at this now. So the article compared 3 different sets of run chart rules. They looked at the ones that they call the Perler rules that you might have seen in a lot of IHI references, which are that you look for a shift of 6 data points, a run of 6 data points, and you also look at trends, which are points going up in the same direction or down in the same direction. They looked at the Carey rules, which try and accommodate the fact that you're doing multiple comparisons with run charts, so you can't just have one answer for how long a shift should be. So the Carey run charts are that if it's fewer than 20 data total points, then you need a run of 7 points to be a shift. And if it's more than 20, then you need a run of 8. And they also look at trends, but they make it a bit harder, of 6 sequential points. And then there's what is called the Anhoj rules, which are calculated to give a less than a 5% chance of having a shift for any length of data. So that's a bit more complicated. They look at the binary logarithm of the total number of points in the run chart. So the binary logarithm is, a binary logarithm of 2 is 1. The binary logarithm of 4 is 2. The binary logarithm of 8 is 3, and so on. And so again, the number of points to make a shift in a run would be dependent on the total number of points. If it's less than 12 points, you would need more than 7 to make a shift. 12 to 22, you would need more than 8, and so on. Okay, and so in this article, the authors compared these different run chart rules. And to do this, they simulated 18,000 run charts of different lengths. In 18,000 of them, the data was just random the whole way through, so there was no change. In 9,000 of them, in the other half, they built in an intervention where the data increased by 2 standard deviations to see how effective these run charts were for picking up these changes. And they looked at different lengths of data. So they had 9 different groups. So starting in the bottom left, this is 6 baseline data points and 6 intervention points. Above it is 12 baseline points and 6 intervention points. Above it is 18 baseline points and 6 data points. And in the other column, in the next second column, it starts at the bottom with 6 baseline points and 12 intervention points, and so on. Okay, so they did all of this simulated data and looked at the 3 different rules to see how well they worked. And to do this, they compared the likelihood ratios for the 3 different run chart rules. Okay. So a likelihood ratio is what we use to understand diagnostic tests for clinical diagnostic tests, but it can also be applied for this type of diagnostic test where we're trying to find a change in the data. And a likelihood ratio is basically the ratio of true positive, the positive likelihood ratio is basically the ratio of true positives over false positives, right? So it tells us if you get a signal, if you get a signal saying that there is a shift, what is the likelihood that this is true? And then the negative likelihood ratio is the opposite. if you do not have a signal, what is the likelihood that that is true, so it's a measure of false negatives. And they looked at these three different rules. So we'll go through them a little bit slowly. So with the parallel run chart rules, looking for a shift of 6 looking for a shift with 6 points. And again, this is with data that had 12 baseline and 12 intervention points. The positive likelihood ratio here is 2. So that's not very good. That means that for every 2 signals you see, every 2 times you see a shift of 6 data points, you will also see 1 which is incorrect. So out of every 3 shifts, 1 of them is a false positive. It showed up in a simulated data set that didn't actually have any change. So it doesn't perform very well. A positive shift with 6 data points doesn't give us that much information. Not seeing a shift makes us very confident that there was no change in the data. Okay, so the negative likelihood ratio is very good, right? So a quick rule of thumb for likelihood ratios is for a positive likelihood ratio, you would like the test to be more than 10, okay? And you would like the negative likelihood ratio to be less than 0.1, right? So a positive likelihood ratio 10 means that for every 10 real positive results, you're only going to get 1 false positive. A negative likelihood ratio of 0.1 means that for every 10 negative results, you're only going to get 1 false negative. Okay. The Kerry rules perform much better on that positive likelihood ratio. They had a 9. So again, that means that if you see a positive signal, a shift that meets the Kerry rules, you can be pretty sure that it's correct. It's not a false positive. And it performs pretty well in the negative likelihood ratio as well. And the Anhosh rules perform even a little bit better. You're very likely to see a false positive, and you don't see a lot of false negatives. Okay, and this is for a relatively short set of data. This is only 24 data points. And these rules get even stronger the more you go out. In particular, the Anhosh rules perform better with more data, and the parallel or IHI rules perform worse with more data. Okay. And I'm going to take some questions because I know some of this is a bit complicated, so we'll take some questions in a little bit. But the next thing to talk about is what to do when you do see a shift, right? So when you do see the data, you're getting a bunch of data points over the median or below the median, you're getting a shift, is you need to reset the median, because you're now asking, how is my system compared to the current system? So you need to get the median for the current system. Okay, so let me stop there and take any questions. I'll just shrink my screen so I can see the chat as well. Okay. Great. Any comments or questions or thoughts? You can put your hand up and just ask them, or you can put them in the chat.
If you have any questions, you can raise your hand. We can unmute you and you can ask your question then.
So I think we have one question from Shashidhar regarding any software which helps us in preparation of these charts.
Okay. Yeah, so let me just, any software. So yeah, there are different softwares. There are, I mean, I just do it in Excel. I just plot the data and plot the median, and then I just look at it by hand. And if there is a shift, then I change the median. So that's the easiest way. You can also buy macros for Excel that I think do this, and I think you can set the rules themselves. You can do that. So R also has a module that you can use. And I think quite a lot of, sort of statistical programming have it. I just do it myself. It's easy, and I like to look at the data rather than let a machine do it for me. So yeah, shifting the median. That's a good question. So yeah, you should use the same points that made the shift. Okay, so if you're going to use 8 points, if your criteria for having a shift is 8 points in a row, a run of 8 points, then I use those 8 points to make the shift. Okay, and I start with the first place where the shift started. Okay, so again, coming back to this example, you know, here, this is the first data point. The week 10 is the first data point where the shift starts. And so that's where I changed the median. Okay. Sorry, I'm just looking for the chat. Okay. At what point do we need to decide to change the median? Well, you change the median when you see a shift. Okay. And that depends on which rules you're going to use. I'm going to come back to that in a second. I'm going to talk about the more practical side of how we can do it. Yeah, so lots of questions about the shifting the baseline. I'm going to come to that in a second. Okay, and someone is saying there is an SPC for Excel. So that's a macro, I think. Do you have to buy that, or is that free? I don't know.
Nigel, I think Dr. Prabha has raised her hand, so we can request Dr. Prabha to unmute herself and ask the question. Dr. Prabha, please.
Thank you, sir. Good evening, Dr. Nigel.
Hi,
I
Dr.
just want to ask, yes, sir. Suppose we got a shift in our done chart, and what happens when we start a project? Initially, we take our data points too frequently, like weekly or fortnightly. So suppose when we got our result, we achieve our target, like suppose we are targeting for 80%. We achieved 80% target, we got a shift. Then can we decrease the frequency of collecting data or monitoring the, plotting the data?
Yeah, that's a good question. So I think that's a little bit different from the run. You shouldn't really do that with the same run chart because you're comparing different things now. But you know, if your goal is really just sort of surveillance to see that the system is maintaining, I think that's fine to do it less frequently. And you would just use your you can use the baseline that you had before and plot against that. Yeah. But I think that's a practical approach for looking at sustainability.
Yes, sir.
I think Yangchen
for a long-term project, is there any? Hello. For a long-term project, is there any rule for how many? For a long-term project, is there any rule for how long we should collect data weekly or fortnightly, and then we should collect data when we achieve the target, we should collect data monthly for plotting purpose? Is there any rule like
no.
For first 3 months or 6 months we should collect data weekly, then on after? Okay.
No, you have to use your judgment.
So Dr. Prabha, we will discuss it later. I think Yangchen Dolma also raised her hand. So Yangchen, can you unmute yourself and ask the question? Then we'll move ahead because we have to, yeah, Yangchen, please.
Yeah, good evening, Nigel.
Hi, Yangchen, how are you?
I'm good. So I had a very since many I would like to ask this. So when we are talking about testing changes very quickly, in a very small set, very quickly we have to test. So yes. How to plot those changes which are like, if it's significance, yes, we have 5-6 data points, but then when we are testing them very quickly, 1 or 2 days and all, so we don't have enough data points.
Right.
So how do we show that it's not working, abandoned, or all these things actually?
Yeah. It's a great question. It's a great question. I'm going to address that a little bit in the next section. But yeah, for small PDSAs, run charts aren't helpful. Okay, you need to measure those in other ways, particularly when you're just testing ideas with a few people. Run charts can't measure that. Okay, and I'm going to come to that in a second, but it's an excellent question.
Okay. Thank you.
So let me move ahead then. Okay, so now let's talk about a little bit how to use it. Okay, so there's a couple principles here. First of all, you should use all the information that you have, not just run chart rules. Okay, you have a lot of information on your hand when you're working in the facility, and both of these graphs would say the same thing on a run chart. They both have a run of 4. But the second one, the one to the right, is obviously a lot more compelling because it's moving a lot further away from the median, right? So, you have to take that into consideration. There's no math behind that, but use common sense. Additionally, you have a lot of qualitative information when you're working in a facility and working on a project. And so with this data, you could have 2 scenarios. Scenario 1 is that your team identified that performance was 0% basically on Sundays because we didn't have a midwife working that day. After week 6, we changed the roster to ensure that a midwife was always available, and basically immediately performance improved by about what we would expect it to improve based on one day moving from 0 to much higher. Scenario 2 might be we did a 1-hour training for all staff way back in week 3. Okay, so you should be much more confident about scenario 1. The data say the same thing, but the chance that your change in scenario 2, which is a weak change, which isn't informed by any analysis and which happened a long time ago, that led to that change in data is very, very low. The probability that scenario 1 could lead to a change like that data is pretty high. So 3 points wouldn't be enough to change your median, but you would want to be continuing to make that change. Okay, so principle 1, use all the information. 2, principle 2 is a bit related to this, and it's what you're talking about, Yang-Chen, that with your small PDSAs, run charts are not the way to measure this. Okay, and I think, we sometimes make it a bit confusing because PDSAs means lots of things, unfortunately. I think it can be helpful to think of 2 types of PDSAs. One where we just are there for testing, and one where we're doing implementation. And one way of thinking about these is that a testing cycle doesn't use many patients. It uses fewer patients than you would see in one data point. All right, so if you are plotting weekly data, then a testing cycle would be done in less than a week. It might be an hour, it might be half a day, it might be a day, but it's less than a week. While an implementation cycle would be more than a week. It's where you think something is going to work and you try it for all of the patients to see if it affects the whole system. So testing cycles can never show up on PDSA. Testing cycles can never show up on run charts. There's no way for that to happen because you're collecting a whole bunch of data, but your test is only done in a few patients. Okay, run charts can help you measure implementation cycles. So most of our PDSAs should actually be the testing cycles, right? They should be the little things that we try for a couple of patients or for a couple of hours to get new information, right? To get information, to learn if a change is feasible, to learn if it's effective, but we need to measure it in a different way. And once you've gone through a bunch of these cycles and built your confidence, then you can implement them, and then you can see the change on the run chart, okay? And so this can be confusing because some people really get stuck on the run chart and then they sort of ignore the testing PDSAs. And that's a real problem because it means you don't try the ambitious changes. And so here's an example of how this might work, okay? So a facility might be trying to improve the frequency of postpartum assessment. And they plot their data every week. And let's say they look at the number of assessments per patient in the first 6 weeks after delivery. And they do an analysis and they find that the big reason why women are not getting assessed is because it takes so long to assess women. And it takes so long to assess the women because everything's a bit disorganized. The equipment is never kept in the same place. Women can be placed anywhere in the ward, even right after delivery. And so nurses spend a lot of time looking for equipment and looking for the woman. And so the team might decide to make two changes. One, put all the women in a room close to the nurses' station, so you know where they are and they're easy to assess when they need a lot of assessments, and maybe keeping the equipment in the same place so that you don't have to spend time looking for it. And so you might do some testing PDSAs initially, because just changing your entire ward based on a hunch is probably not a good idea. You'd like to build up some confidence that this makes sense. So you first might like to find out whether these changes are feasible. Talk to the orderlies and see if they can put some new patients just for half a day, basically, and see if it's feasible for the orderlies to do it. And try and always put the equipment there, right? And just do this for half a day again. And these tests are very important. These small testing PDSAs are incredibly important, but they will never change the run chart. It's just not possible, right? Even when you start testing it for a couple of days, you'd have to measure how long it would take, for example, and compare it to what it took before. And you can learn that this test is feasible. And you can become very confident that the test is feasible and effective. But again, it won't change the run chart because your run chart is looking at weekly data. It's only when you start doing, implementation tests where you might say, let's try it for 2 weeks to see if it works. This can move your run chart, okay? So, PDSAs and run charts are not always linked. You should do lots of PDSAs that aren't going to affect the run chart. Those are your testing PDSAs, and you need to measure those in slightly different ways, okay? And the other principle that's important is to look at your charts in real time and to update the median. I think a lot of projects I see, people obviously didn't look at the data for a long time and just put in the median at the end and then look at the data. And you're missing a lot of opportunities here. So updating the median is important, okay? And so here, and there is obviously a shift, but is there only one shift or is there more than one shift? When you look at the data like this, you don't know. So what you do need to do here is update your median. And again, this is what a lot of people were asking, how do I do that? So in this case, to update the median, we used the points that made the shift, which in this case was, sorry, I'm trying to get my pen here. Yeah, was these points. Oops. Oops. Sorry, I'm not very good at drawing with. Yeah, anyway, you get the idea. So these points are used to calculate the new median. And then okay, sorry, yeah. Okay. And then the same thing, you update it, and then you can see at the end, there's another shift at the end. So again, they would update the median using those data points again. And this is important because it helps you look at further improvements, and it also lets you understand sustainability, right? If your results go below the median again, your results are not sustainable, okay? Here's a practical approach. You should always look at your median, and then if you have made some changes that you're confident will work, where you're identified and addressed a system type problem or problems, you should be happy when you start to see 3 or 4 points going in the right direction, especially if they go a long way from the median, especially if the time of the changes and the time of the shift makes sense, and especially if everybody's sort of subjective opinion is that this was a good test. You shouldn't be totally confident yet, But I think using the carry rules to change the median is useful here. So when you start to see 7 or 8 data points, you use those 7 or 8 data points to change the median. You should be much more skeptical if you're not actively trying to change the system, or if you're just doing sort of routine stuff, okay? So if you have not made changes recently, or if you've just done things like training a bunch of people or setting up a WhatsApp group or something, you know, those are low confidence changes. They usually don't do very much. So you should be very conservative and you should look for a longer run. You know, and just sticking with the carry rules here, I think, is useful. Okay, and let me stop there again. Any questions or comments? Let's see, there's a couple of questions. PowerPoint shared? Yes, sure. This PowerPoint will be shared. I updated it a little bit, Sonam, but I'll send you the updated one. And then, are run charts needed to be shown for processes too, or just outcomes? Yes, definitely. You should, in general, use them for both. Okay, you know, the process is what you're actually trying to change. So you have much more control over that. So you will usually see changes in the processes before you see changes in the outcomes. Some outcomes are very, very tightly linked with the processes, so they can change quickly too. But a lot of outcomes you need to work on more than one process. So yeah, for during your improvement project, usually you're focusing a bit more on the process, and then you might have a larger kind of improvement program trying to reduce mortality, for example, in an NICU, where you would be measuring the outcomes as well on a run chart, but you might need to work on a number of processes to address that. Any other questions, comments?
Yeah, Nigel, can I? Dolma here again.
Go ahead,
I have 2 questions. So first one is regarding the PDSA testing ideas. So we if I understood it properly, it is.
Hello? Yangchen, I think we lost you.
Yes,
Yeah,
yes.
Yeah, sorry, go ahead.
Yeah, so if I understand it properly, while testing change ideas, we need to see whether that idea is effective or feasible, right? And not and see it qualitatively whether it's working or not, right? And not depend on the run chart.
For testing ones, the run chart usually won't help. Okay, I mean, if you have a run chart where you're looking at daily data, then you can use it, but usually you're not, right?
So if it's feasible and effective, we can either adopt, adapt, or abandon it, right?
Exactly.
Okay. And second question is regarding this new median from the baseline. We see if it's a shift, and we have 6 data points, and then do we extend it till the shift is broken, or yeah?
So yeah, the same way that you do with the baseline, you do when you redo the median as well. Okay, so you know, you draw the points, you draw the median, and then you extend the median. You would do the same thing when you see a shift. So I don't think 6 points is enough. You know, I would be careful with using 6 points. You're going to get a lot of false positives. But whatever rules you decide to use, if it's 7 or 8 or whatever,
7, 8.
when you draw that shift, you extend it, because that's what your question is in the future. Is my performance staying the same, or is it changing?
So we won't be we won't be taking the whole data points till the shift is broken. What we normally used to do is, if we have 2 new medians, what we used to do is whole data points, we take the median of whole data points. So is it correct, or do we need to take just a shift part and then extend it?
Yeah, so it's, you know, I would, so first of all, it's easier to do this if you're working prospectively, right? I mean, that's why I'm saying one of the problems I see is a lot of people do the run charts with retrospective data, where you collect data for 4 months and then draw a run chart. I don't think that makes sense. it makes sense to draw it from the beginning and then add points prospectively, right? So then your question isn't relevant, because once you see, let's say, 8 data points which are above the median, a shift, you draw the new median with those 8 data points, and then extend that median.
So then if then whenever that median is the shift is broken, then we'll draw the new median, right?
And then you'd redraw it.
Thank you. Thank you.
Thank you, Dolma. I think we have Swati also raised hands, and Mamoon. I think we'll take 2 more.
Yeah,
Swati,
yeah.
please.
Good evening, Dr. Nigel. This is Dr. Swati here. I would like to ask you, yeah, Dr. Nigel, am I audible?
Yes, please, go ahead.
Yeah.
Go ahead,
So I
Swati.
would just want to ask a question that the most difficult part in any QI, so the most difficult part in any QI project is collection of data. So my question is that, we might be doing it after every 2 days, 3 days, because, most of the data in usual hospitals, they are collected on monthly basis. So the most, the main in QI projects is collection of data. So is it possible that we can check our data at the end of the month just for the sake of ease? Is it a good idea?
Can you collect monthly data? You said. So yeah, I mean, you can do.
Is it necessary to collect? Yeah, is it necessary to collect it frequently?
Well, okay, if you need, but let's say you decide that with your data you're going to take 8 points for a shift. Then if you have a run chart with monthly data, you need at least 8 months before you can see a change in the data. That's the problem with infrequent data collection. So you might be able to do other sorts of measures. And for outcomes, that might be okay. If you're looking at mortality, for example, that might be okay. If you're looking for processes, I think you usually want to do it more frequently, if you can.
Okay. Is it necessary?
But it really depends on.
Is it necessary? That is what I want to ask. Let's suppose we want to lower our cesarean rate. So that is a more long-term thing that we are planning.
And monthly makes sense. Monthly makes sense. Yeah.
Okay.
Yeah. Yeah. It's a hard question to answer generically, but for outcomes like that, monthly is fine. And sorry, I see a couple of questions here. We'll just finish those.
We'll request the people to be brief in their question, and so that everybody gets an opportunity. I will request Mamoon and then Dr. Anupa. Yeah.
Hi, Nigel.
Hello.
Yeah, I'm Dr. Bhuya from Bangladesh.
Oh, hi. How are you?
Yeah, I'm fine.
Great.
So I've been working with IHI.
Great. Okay.
Okay. So just my question is that what I have learned from my previous part, that is it's a median baseline for median is fine to interpret the data. But what about the sometimes we say that we are using P-chart, using upper control limit and lower control limit and central line. So this is one thing that is very easy to understand which is going wrongly or beyond our expectations. So what's your suggestion? So actually, is this median is fine or
well, yeah,
is better one?
I use run charts much more than control charts. Control charts are just a bit harder to teach people how to use. Run charts are much more intuitive. You can do it on paper. You don't need anything. So I use run charts a lot more.
So my just another question is that sometimes you see in the data there is huge jump that is we call an astronomical point.
Yeah.
If you see something like that, especially starting of any project that we are trying to change it. So if there is any astronomical point, then what should we predict? What should we assume? Is there what will be the most probable causes for behind this astronomical rises?
Oh, I don't know. You need subject experience for that question, right? You need to talk to the
sometimes
facility.
in Bangladesh, I am doing. Sometimes I see that, okay, they start the point 1 or 2 database. Then if documentation or something, the major problem if they address, that is astronomical rise. So, but the audience of the audience sometimes get just little bit or if, why there is sudden rise? So from your expert eye, what do you suggest?
Well, no, that's what I'm saying. You would need to go to the facility and talk to the people. This is where the subjective information is important.
Okay,
So there's no way of answering that generally. So there's a number of questions written down. Let me just answer those quickly. So Manjupuri, if I understand correctly, testing cycles cannot be depicted on run charts due to frequency. Basically, right? I mean, if you're collecting weekly data and you do a test which is half a day or a day, it's not going to really show up on the run chart. Okay, so most of your PDSAs you need to measure in other ways. The run chart won't really help you. Anupa, we map our run charts to our PDSAs. No, I think these are separate. You have a run chart going, you do PDSAs. Some of them will help with changing the run chart, some of them will not. Yeah, but they're separate. Don't do run charts based on PDSAs. When do we use? Yeah, so this was related. I don't do a lot of control charts. If you want to do them, and sometimes they're very, very useful, you know, particularly when you don't have big changes. But I see them used incorrectly way more than I see them used correctly. So I'd be a bit careful with it. Is it possible to change the time axis depending on the change idea? No, you should keep it the same. If you're going to collect weekly data, keep weekly data. Then there's a break. Exactly, with Jesse Paul, that's right. If resetting the run chart, the median helps you understand if it's sustainable. Okay, so let me just, we've only got a few minutes left, so let me go fairly quickly. The next section I was going to talk about was how to describe run charts in publications. And this is weak in a lot of QI publications, basically. It's impossible to know what the people did for measurement. So this would be my suggestions. You know, in your methods section, first of all, just say which indicators you're looking at. Do say how frequently you're collecting data. Do say how many data points you used in your baseline, and more is better. And do say what method you plan to use to define a shift. And for publications, I would use the Anheuser rules. Right, they are set up so that there is a less than 5% probability of seeing a shift, assuming the null hypothesis. So I think that's the best rule to use if you're talking to external groups. And then talk about how you're going to calculate the new median. So an example might be, you know, we collected 6 weeks of baseline data, and we use this for the baseline median. We plotted weekly data, we defined a shift according to evidence-based rules, and just refer to one of the Anheuser papers. And then we recalculated the median using the points that made up the shift. Okay, so pretty simple and straightforward, but it's missing in most papers. And then the results sections, you're kind of just saying this again. What was your baseline median? What was the value? When did the improvement work start? If you saw a shift, and when did it start? Which points you used to calculate the median, and what the new median was, and any subsequent shifts. So again, our baseline data showed a median performance of 34% in the first 6 weeks. We identified a shift of 8 data points starting X 13 weeks after the baseline period. And we recalculated the median using those 8 points and had a new median of 55%. And then what happened after that? And it might be that we saw no additional shifts for X data points, or we saw a new shift, and it could be a shift or improvement or a shift of getting worse, suggesting a problem with sustainability. Okay, and let me just finish up here quickly. And so these are some of the common mistakes I see. Okay, 2 of them are related. So sometimes I see that people make a median for each PDSA cycle. So they make very long PDSA cycles, like for 2 months or something, with multiple changes, which is actually not what a PDSA cycle is. But you can't decide to set a median with a run chart. You can't say we're going to get the median for this period of time. The data will tell you after the baseline whether to reset the median or not. You change the median when you get a shift, not when you do something again. Okay? A similar one is some people do a median for baseline, a median for intervention period, and a median for sustainability phase. And again, that's incorrect, right? If you want to look at the data for 3 different periods, you would have to use some other statistical test. A run chart is not appropriate. You can't use a run chart like for that purpose. Okay, so a run chart is you have the median and you change the median when the data tells you to change the median, not when you do something different. Another common mistake, and I've mentioned this a couple of times, is calculating the median for the whole data set. Right? Run charts are used prospectively. That's what they're for. They're used to say whether the things are changing from how they used to be. Doing it for the whole data set really doesn't make any sense. And then not resetting the median, I think, is another problem as well. And this means that you no longer can analyze your data. So you have to reset the median when you start to see a shift. Okay. And then I see a lot of mistakes when people are teaching run charts as well. Okay. And most of them are making it too complicated. Okay. So if you're working with new QI teams, really don't go over the stuff I talked about today. Okay. You know, keep it simple. Get people working on doing time series data, get them building in the median, but you don't need to go into the math or the different rules initially. Okay, and it's tempting to do that because a lot of people use this as a way of showing off, right? They want to show off their expertise, and making math complicated is a good way to do that. Don't do that. Okay, show off by helping your teams get great results and then show off those results. Don't show off to your team by making things complicated. Okay, and then the other common mistake, I think, is not asking enough about qualitative information, right? Data has strengths and weaknesses, but stories about improvement and changes also have a lot of strengths as well. And we need to kind of not give up on that. Don't get too focused on the points on a graph. We're really there to help people and help health workers. So get information from all sources as well. So let me stop there, and I'm finished the presentation, but I think we have a bit of time for a few more questions.
So thank you, Nigel, for an excellent presentation. I think with the amount of questions which we are getting shows the degree of interest and curiosity which have been generated by your presentation. So we'll be taking questions. Please be brief. And I'm very sorry, we will not be able to extend this as a conversation. It should be a question. So let's go with the questions which have been posted.
So yeah, someone is asking about following an outcome indicator which is stable.
Yeah.
You can use that as the baseline. Yeah, you don't need to collect prospective baseline data. You can do it retrospectively if you're happy with the data quality. Yeah, that's completely fine. Next question. I don't think qualitative information requires a separate ethical clearance because, you know, this is the story about what you did. We met as a team. You don't need ethical clearance to say that, or, you know, we moved the equipment over here. That's fine. Every organization has different rules, so check with them, but that should be fine. How much of a shift is needed to draw a new median? That's for you to decide, right? It depends on which rule you're using. For publications, I would use the Anheuser rule, okay? I think that's the best one. It's a bit complicated to write down, but it's the simplest one. For day-to-day improvement work, I would use the Carey rule. So it's if you have fewer than 20 data points, a shift of 7 is enough. A run of 7 is enough to shift. If it's more than 20, I would use 8. Okay, so if you start to see runs of 7 or 8, that's when you should recalculate your median. Okay, if you want to be a bit more conservative, use the Anheuser rules.
Nigel, there's one question.
Faisal. Hi, Faisal. so I put a couple in the presentation, and now they've just been put into the chat here. There's another good one as well. Well, actually, if you go to the PLOS one, there's a bunch of references in there, which are very useful. That paper on its own is very good, but there's some other papers that group did, which are also useful. Those would be the best things, I think. Yeah. Sorry, Sushil, go ahead.
Nigel, there was a question in the question box also by Dr. Amol Joshi. He wants to know that sometimes there is a challenge of missing data off and on. What should we do for plotting on x-axis as the run would reach 0?
It's a good question. You know, I would say just exclude that. Don't put it as a 0, just exclude it and don't count it as a point or a point in the shift or a point in the run. That's kind of all you can do. You know, it would be hard to publish if you have lots of missing data, but for routine improvement work, you know, that would be okay. Oh, sorry, I didn't even see these questions previously. I apologize.
No problem. I was just going through that. He also wants to know that use of annotations on time series chart to depict change ideas tested. Is there a specific method to depict those PDSA data points?
I don't think so. And again, you know, some of your testing PDSAs will be very small, right? You might do things with 1 or 2 patients. It's really hard to annotate graphs when you do that. I think that's one of the problems with annotating, is that it pushes you to think about big changes. But teams need to spend a lot of time with the little testing changes. Just these ideas that you try with 1 or 2 patients, they're really valuable. They might take a few minutes. Right, but if you don't do those, you're a bit stuck. If all you do is the big week-long PDSAs, then you're not doing the interesting changes. You're doing the safe stuff. And that can work, but sometimes you need to be more creative, and the little PDSAs help you.
Nigel, there is another question from Varad Kuntambekar. How do we plot a chart if we change the frequency of monitoring data from weekly to monthly while changing from implementation to sustainability phase?
Yeah, so it would be very hard to do that in a publicable publication, because you're comparing different things. For day-to-day improvement projects, I think you just kind of do it, right? Because, you know, if you've improved a process and you're confident that it's going to stay like that, reducing data frequency is fine. And you can use the same median, your final median, as the baseline to compare against. I'm not sure you would get that published. Journals have issues with that. We have done it before. I've done one paper like that was okay, but it took a lot of back and forth with the reviewers to justify it. But for day-to-day work, it's the right idea. You know, doing less work and getting enough information is fine. Okay.
I think that I think we have answered most of the questions. If somebody wants to put a question, he or she can raise a hand. I think we have about I think Bharat Ji has raised a hand. Please, Bharat, you can unmute yourself. We will wait for another 3 to 5 minutes more, and then we'll be wrapping it up. Yeah, Bharat.
Hi, am I audible?
Yeah, you are audible. Please go ahead.
Yeah, suppose we do a study which is a big one. Like I did a study where we had to reduce the door to balloon time in patients of myocardial infarction presenting to the hospital. So in that, we divided it into different parts. First was door to ECG, then we saw door to cath lab time, and then door to PCI time. So in such a type of study, do we plot 3 different run charts, or how do we do it?
Yeah, I think so. That would be the practical solution for that for me. Because, yeah.
Okay, so then we have a final one which says door to PCI time, because that's what
the total, yes.
Okay, so we have different ones. Okay.
Yeah, because you know, and the reason for that is practical, because the changes you would be making would be on the different sections.
Yes.
right? And so you want as much information as you can get early about whether that section changed. And then your overall measure, might take a little bit longer to change. So you'd want to look at both.
Okay, thank you so much.
I see a question from Dr. Anupa. Dr. Anupa, could you unmute yourself and please say your question? Dr. Anupa is one of our executive board member, and she's a gynecologist. Yeah, Dr. Anupa, please.
So what I wanted to ask Nigel was that when we are changing the frequency of data collection, can we have separate run charts to be more, when you're thinking of publishing our work?
So you mean you were collecting it weekly and now you're moving it monthly?
Yes.
Yeah, I mean, what data is it?
For example, if we are collecting a data around a labor room where we have a project which is about.
You have to come closer to the mic. Sorry.
For example, if we have a project in the labor room which is about partograph charting, for example, we realize that initially we are going on from your daily. The delivery load is high in that labor room. We were doing something which was daily. Now we are doing it weekly. So can we have two separate run charts?
Yeah, I think, yeah, that's fine. I think that's good. That would probably, I mean, for day-to-day improvement work, it doesn't matter. But for a publication, they might like to see that better. Some reviewers are sort of picky about that, I think.
And the other thing which I wanted to ask you is that often the teams integrate their PDSAs into their run charts. So you will see that there is a run chart where they are plotting the data points, they have a median, and they will be marking their PDSAs, trying to show a shift and a change. Is that a good practice or it should be discussed?
Yeah, say that again.
Often in a run chart, teams will, integrate their PDSAs into the run chart. So they will have a run chart, they will show a shift of the median, plus they will also show an arrow with their PDSAs marked, mapping those, changes. So is that a good practice?
I think that's fine. Again, some of the small testing PDSAs, there'll usually be too many to put on the run chart. And so don't not do those because of that. Right? The goal is to improve care, not make a nice run chart. But if you want to list where the sort of bigger implementation changes PDSAs were and the changes in those PDSAs, I think that's fine.
From the publication point of view is what I wanted to do.
Yeah, they sort of like to see that. I'm not a huge fan of annotated run charts myself, but I think publications kind of like to see those.
Thank you so much, Nigel.
So we have one question from Dr. Manju Puri regarding whether they can have separate run chart for sustenance phase
Sure.
of project. I think you have already answered that.
Yeah, that's fine. Whatever works for you. Yeah.
Okay. I think I see no more questions. Nigel, it has been a very excellent, very lucid talk, except for some of the important studies which you showed us initially, which also made us think about the need to understand what is the number of observations which we can consider significantly for calling it as a shift. I think that was very, very important. We also got a new perspective from that. And more so the special common mistakes which you discussed, which we all generally tend to do while writing a paper or making the observations. I think they were very, very useful. I think your talk has been—
I've made them all myself, yeah. So
yeah,
I'm
so
pretty good at
it has been a great learning. And for all the your audiences, we promise that this talk Nigel has allowed us, we will be putting it on our website. You can go and see all the slides, as well as you can refer to the presentation, also a live presentations for your clarity.